A brain tumor the size of a grapefruit.
It's hard to comprehend that someone could function or live with something that large growing in their brain.
Can it be removed? A spine snapped clean in two.
Obviously, when I first saw the x-rays, I was convinced that the patient was going to be paralyzed.
Escaping the reality of pain.
Sometimes they laugh instead of cry, and it's really amazing to see the difference.
A virtual world for burns patients. A construction nightmare.
This particular gun, for no reason, just went off.
Straight into the heart. The mystery of burning hands and feet.
The pain can be so severe that it can drive patients to suicide.
What causes this excruciating pain? And from near death to black belt.
They said her chances of coming through are 1 in 10.
The little girl who beat the odds. The most incredible species on the planet is human. February 2005. For 47-year-old Barbara Marshall, it was an ordinary Sunday. The mother of three had no inkling that a medical time bomb inside her brain was primed to explode. Barbara's husband, Jack, was restless that day.
We were sitting around the house, and I said, let's go do something.
The couple walked out of their El Centro, California front gate at 1 p.m.
I walked around a pole, and for some reason I just happened to turn around and look and see where she's at.
Barb, you all right? Barb? Barb?
And I thought she had just stumbled and fell against a post.
Barb, hold on. What's happening to you? Help! I need help!
I could see that her whole right side of her body had just gone limp.
There'll be somebody here in a minute to help you, okay? Stand up.
I grabbed a hold of her, and she looked at me and said, help. And that's all she could say.
A passerby called 911.
The ambulance showed up. It's hard because you don't know what's going to happen.
ER staff at El Centro Regional Medical Center responded frantically.
Stroke.
All signs pointed to a massive blood clot or bleeding in Barbara's brain.
Marshall, are you here?
You're right.
Barbara was in bad shape. Her family prepared for the worst. Barbara drifted in and out of consciousness. Her mind was in a fog.
They went ahead and gave her a CAT scan, and the doctor there recognized that it wasn't a normal problem.
The CAT scan showed that an enormous foreign mass had overrun Barbara's skull. She was rushed to Scripps Memorial Hospital, Loyola, 120 miles away. Scripps neurosurgeons took more brain scans. What the images showed astonished even the seasoned brain surgeons. The massive tumor had invaded a full third of Barbara's skull cavity.
I've been involved in probably on the order of 1,500 to 2,000 neurosurgical procedures, and this was absolutely the biggest tumor I had ever seen. No tumor had even come close.
The tumor had wrapped around her blood vessels and optic nerve. It had begun to invade her eye sockets and nasal passages, and it was pushing Barbara's brain down into her spinal column.
Her brain had gotten out of the way as much as it possibly could, and now it really had no more place to go.
The massive growth had become a menacing killer. Doctors gave Jack the news he dreaded.
Your wife should be dead. There's no way she should have been living.
There was no option. The benign but steadily growing mass had to be surgically removed. But Barbara's chances of surviving the operation were slim.
The last thing I remember when they took her into surgery is he told me that she has 2 blood vessels that come up from the center of the brain. Before he went into surgery, he said there's another set that goes from the forehead back to the brain. He said if we touched any of those 4, it should be an instant death.
Would these be Barbara's last few hours alive? Later, brain surgery that would test the limits of modern medicine.
You all right?
In February 2005, 47-year-old Barbara Marshall had collapsed with what looked like a conventional stroke. But what doctors discovered stunned them. Barbara's skull cavity had been invaded by the biggest tumor they had ever seen, and it was relentlessly squeezing out her brain. There was no choice but to cut it out. Nose surgeon Dr. Michael O'Leary attacked the tumor by working upward through Barbara's nasal cavity. Neurosurgeons Drs. Coufal and Gauche worked downward through a massive opening in Barbara's forehead.
If I was to draw the opening of the skull on my own head, it would extend from just above the eyebrows back to this point, and then up behind the hairline to this point in the middle.
It was knife-edge surgery. Any drop in blood pressure could reduce oxygen supply to the brain, triggering catastrophic strokes. Carefully, blood supply to the tumor was cut off. If the mass began to bleed, Barbara would hemorrhage to death on the operating table. In the waiting room, Jack clung to hope as the hours ticked by.
Oh, it's like a numbness. You just sit there and you wait.
Throughout the day, the mass was gradually cut away. Tiny remnants were shaved down to within millimeters of major blood vessels. Finally, it was over. But would Barbara's damaged brain recover? For weeks, Barbara lay in a coma. Doctors became nervous.
We were very anxious that she would emerge from this fog and start to show us signs of progress.
One of these days you'll have to talk to us.
Then, at about the 3-week mark, something remarkable occurred. It happened soon after the doctors had called a family meeting.
They told me she's going to be in a convalescent hospital. She'll probably never walk again. The tumor was so big that it pushed down on her frontal lobes. She may not see. You know, they give you the worst scenario, which hit me pretty good. So at that time, I bawled my eyes out again. I went back and I tried to talk to her. She wouldn't say nothing. And I told her, I said, if you don't open up your mouth and talk, I'm not going to come back up here. And I'll see you later. And then, out of the blue, she just turned around and said, where the hell are you going?
And I looked at him and I started cussing at him. And I started talking.
I think we talked for 3 hours. She didn't make a damn bit of sense, but she talked. And then everything from then on just seemed like it was uphill.
After 2 months, Barbara was released from hospital. That was 8 months ago. Today, Barbara Marshall is steadily regaining her life. She loses concentration once in a while, but she's learned to walk again.
Take your time.
For someone whose brain had been so relentlessly consumed by a giant tumor, the speed of Barbara's recovery astonished even the doctors who saved her life.
Her tumor was such a formidable challenge that really it pushed the absolute limits of what we can achieve with surgery.